Hello everyone, my name is Dr. Jyoti Singh and today I'm going to discuss with you heart disorders from a class 11th biology book. And in this video we are going to discuss about three heart disorders, that is coronary artery disease, angina and heart failure. And in the last we will discuss about the differences between heart failure and the heart attack. So let's start quickly our first topic, that is coronary artery disease. So coronary artery disease is also known as coronary heart disease. Also it is known as ischemic heart disease. So these are the synonyms of the coronary artery disease and we can write it in the short, that is CAD, coronary artery disease or coronary heart disease or ischemic heart disease. So these are some of the basic names of the same problem. Now moving ahead, what is the main reason behind the coronary artery disease? So firstly we will go towards the concept making. What is the coronary artery disease? And the coronary artery is a artery which is present in our heart. Here you can see in the image that these are the arteries which supply blood to the heart muscles. So coronary arteries are the arteries which supply to the heart itself, and the heart muscles receive blood through these coronary artery. So if any problem arise in these coronary arteries like blockage, then it will certainly leads to problem in the heart muscles and which corresponds a problem in the heart itself. So the coronary artery disease is basically a disease of coronary arteries. Now so it leads to the reduction of blood flow to the heart muscles. And why there is a problem in the coronary artery? The main reason behind a problem in coronary artery is the atherosclerosis. So what is the atherosclerosis? Atherosclerosis is building of a plaque-like substance in the lumen of the arteries. And this plaque is basically made up of lipids, some fats and the calcium ions. So basically we see that a high cholesterol level which will lead to the development of atherosclerosis very fast. And in cholesterol, the low density lipoproteins are the basic responsible factors behind the development of these atherosclerosis. And so coronary artery disease is basically related to this development of atherosclerosis, and this is the main reason behind development of coronary artery disease. And so coronary artery disease is always mentioned to be as development of atherosclerosis in the coronary artery, which leads to the blockage of blood supply to the heart muscles, which leads to the dying of the heart muscles, and which causes the heart attack or the myocardial infarction. Here in the figure you can see it is a coronary artery, and this is the plaque which has been developed due to the deposition of fats, lipids and calcium ions, and this narrows the lumen of the artery, which leads to the blockage in the artery and which restricts the blood supply to the heart muscles. So there are some symptoms which can be treated as the primary indications of developing coronary artery. So what are the symptoms of a coronary artery? First hand information which we can ascertain that this is the coronary artery disease, that is the chest pain. Okay, so first symptom is the chest pain. Then the second symptom is shortness of breath become fast and it is very short. Now we are going to study some of the complications which arises due to coronary artery disease. First complication is the heart failure. Now what is a heart failure? The normal function of the heart is to pump the blood to all the organs and all the tissues of the body. Now if for any means, for any reason, heart is unable to do this, that is the pumping of the blood to all the major organs of the body, then we will call it the heart failure. Now the coronary artery disease is a blockage in the coronary artery which is inhibiting the heart from pumping the blood. So certainly the coronary artery disease will lead to the development of heart failure. Now the second complication which developed due to CAD, that is the abnormal heart rhythm. So cardiac cycle, we have already studied that heart beats about 72 beats. Okay, 72 to 75 beats per minute. So this is the cardiac rhythm, we can say that in it is the cardiac cycle is of 0.8 second. Okay, one cardiac cycle completes in 0.8 second. If there is some problem in the coronary artery, so it will stop the heart from functioning its normal function, and it will lead to the abnormal heart rhythms or abnormal heart beats. Now, the third complication which can arise due to CAD is the heart attack or myocardial infarction. That is, if there is sudden cut off of oxygen supply to the heart muscle, the heart muscle starts dying, and the main reason behind stoppage of receiving of oxygen to the heart muscle is a blockage in the coronary artery. So the sudden way coronary artery disease always generally leads to the heart attack, that is the sudden blockage of the coronary artery and sudden cut off of oxygen supply to the heart muscles, which leads to the certain heart attack. And the fourth symptom is cardiac arrest. Cardiac arrest is nothing but suddenly a stoppage of functioning of the heart, and about 90% muscles of the heart get died in the cardiac arrest, whereas in the heart attack certain amount of muscles of heart muscles get died, and it can be the patient can be saved, but in the cardiac arrest there is no chance of saving the patient. Now, there are some risk factors, that is the people who are at risk of developing the coronary artery disease more than the normal people, that is persons having high blood pressure. People which are dealing with the high blood pressure are certainly at risk of developing coronary artery disease. And the second group of people are those who are smoking, that is smokers have a high chance of developing the coronary artery disease because because the oxygen supply to the heart muscles is certainly reduced in the smokers, that is they have a many more times increased chances of developing coronary artery disease, which will lead to the myocardial infarction, or you can say heart attack. Then the third category of people who are at risk are the diabetic patients, because diabetic patients have very high blood sugar in the blood, which leads to the development of atherosclerosis plaque in the coronary artery, and certainly these group of people are also at high risk of developing CAD. Then the fourth group is high blood cholesterol. Cholesterol is nothing but lipid and fats. Okay, and certainly the low density cholesterol are very people who are consuming low density cholesterol in their diet is certainly at very high risk of developing the cholesterol. So we can take care that our diet don't contain the low density lipoproteins, so it will reduce the deposition of cholesterol in the coronary artery disease, which will reduce our chances of developing the coronary artery disease. So people having high blood cholesterol are at risk of developing the coronary artery disease. And the last point is that the obesity. We should maintain a proper weight as per our diet, as per our height, and as per our sex and the health conditions. We should always maintain the proper weight balance, and obesity is also, obese people are also at risk of developing the coronary artery disease. Now, there are some of the methods which can be used to diagnose early the coronary artery disease, or if a person is suffering from coronary artery disease and he is having some symptoms, how we can diagnose that he is suffering from coronary artery disease. So here for our help ECG came out. ECG is nothing but electrocardiogram, and through this instrument we can see our heart rhythms like P wave, then Q, R, S, T, and then again T wave, and then this normal cardiac rhythm goes on. If this ECG shows normal value, ECG can detect this coronary artery disease, because the symptom of coronary artery disease is arrhythmic heartbeat. Okay, so it will be detected in the ECG. And the second diagnostic method is coronary angiogram. We can have the coronary angiogram. It is a high advanced instrumentation which can be used to detect the CAD. And the third diagnostic method which can be used to detect the cardiac CAD, that is cardiac stress test, which can be a very good diagnostic method to detect the CAD. Then to prevent the CAD, we can have certain ways through which we can certainly prevent the CAD. That the first way is the following a healthy diet. Healthy diet certainly plays a very important role in our overall health as well as preventing the development of CAD in our body. So healthy diet should be rich of proteins, high fiber and low density protein and high in high density protein. So a healthy diet means a proper balanced diet, not more, not less, and it's consisting of very less amount of low density cholesterol. Then the second thing is we can prevent the CAD is by regular exercise. If we do regular exercise, then our heart will be healthy and our body will be fit. Then it will be certainly prevent us from developing CAD. And then the third thing we can do is maintaining a healthy weight. Like I have already discussed that obesity is also one of the obese people are also at risk of developing CAD. Then maintaining a healthy weight will certainly help us in preventing the CAD. And the fourth point is not smoking. Smokers are also at risk of developing CAD, and if we can quit the smoking as soon as possible, then we will certainly reduce many times of developing the CAD disease. Now the treatments, we will talk about some of the treatments which are available for CAD. That is the precutaneous coronary intervention. This is the first prevention treatment method of CAD. In this method, what we do is we somehow eliminate the atherosclerosis plaque which has been developed in the coronary artery by some balloon-like method or by some laser technique. We can do this by precutaneous coronary intervention, and short form is PCI. This is the treatment for CAD. And the second treatment which is available is coronary artery bypass. We take another artery from any body part and we bypass the atherosclerosis area of the coronary artery, and we bypass that artery through another artery, and this is known as coronary artery bypass. So these are the two treatments which are available for CAD. Now we are going to discuss the second heart disorder which is very common in the general public, that is angina, and angina is also known as angina pectoris. So if we go by the word meaning, angina means to strangle, means something which has been strangled or something which has been pressed so hard. Okay, and pectoris is chest. So in common, if we join these two terms, to strangle and the chest, then angina pectoris leads to the strangling feeling in chest is known as angina pectoris, or we can say a pressurized kind of situation is known as angina pectoris. Now, what are some symptoms of angina pectoris? Chest pain or pressure, feeling a high pain or high severe pain. Okay, sudden severe pain or sudden severe pressure in the chest is known as angina pectoris. Sometimes it has been confused with a heartburn, but the pain of the angina pectoris is certainly very, very severe. So, and what leads to this chest pain or the pressure? What is the reason behind this chest pain or the pressure? Certainly, if heart muscles have been deprived of oxygen, that is, there is improper blood supply to the heart muscles, it will lead to the pain or a pressure kind of situation in our heart. So the main reason behind this chest pain or the pressure is insufficient blood supply to the heart muscles, and this insufficient of blood supply to heart muscles can be due to atherosclerosis, can be due to vasoconstriction, can be due to strangling of blood arteries in the heart, which are dedicated to supply heart the oxygen supply. There can be any kind of strangling in these coronary arteries. Now, so angina, so we can conclude that angina is a symptom of coronary heart disease. So angina is the primary symptom of coronary heart disease. So we can say this statement, but this is not always true. All the angina pain, although some people are having a pain or pressure which is of anginic in nature, or there is real angina pain, but they are not at risk of developing the coronary heart disease. There could be other reasons behind this. Okay, and not all the coronary heart disease patients feel this angina. So it can be at times that angina is a symptom of coronary heart disease, but it is not always like angina is always there in the coronary heart disease, or coronary heart disease is always there in the anginic pain. So, but sometimes angina is a symptom of coronary heart disease. Now the third major heart disorder is the heart failure. So like I have already told you, what is the major function of heart? Heart's major function is to pump the blood to all the major organs and tissues of the body, and this blood will supply the oxygen for the proper functioning of all the body organs. Now if anyhow for any reason heart is not doing this job, so it will lead to heart failure. Okay, so heart failure is nothing but heart's inability to pump the blood properly to the body parts. This will lead to the heart failure, and it is a very gradual process. Okay, now the symptoms related to heart failure are shortness of breath. This is the main primary symptom of heart failure, which any patient is feeling. If anyone is feeling shortness of breath, he will not die suddenly or out of heart attack, but certainly he will visit a cardiologist for knowing the reasons behind shortness of breath. So might be the cardiologist will test, will do the ECG, and will tell him or her that it is due to some heart disorder or some heart improper functioning of some heart valves. Okay, now swollen legs, this is the major symptom of the heart failure, and the rapid heartbeat. So these are some of the symptoms of heart failure, that heart is not doing its function properly. Okay, heart failure is not like heart attack or a cardiac arrest. Heart failure is something some of the symptoms that is telling you that heart is not doing its function properly, it is not pumping the blood proper. Okay, now some of the treatments of heart failure, because there could be various reasons of heart failure. So heart failure treatment can be very diverse. So eating less salt, because eating less salt will prevent the high blood pressure, which will certainly lead to the development of coronary artery disease, which will lead to the heart failure. Then eating less salt is the treatment. Then limiting fluid intake, limited amount of fluid intake will certainly reduce the swelling, and it will also prevent the heart failure. And certain medications which are prescribed by your physician, and the pacemakers. Sometimes there is a pacemaker or the SA node in our heart, that is in our right atrium, and it sends some electrical impulses to the heart, and through these electrical impulses heart is doing diastole and systole. Okay, so if there is some if the heart pacemaker or the SA node is not sending proper amount of electrical impulse to the heart muscles, so heart pumping or heart's systolic movement and diastolic movement are going to get affected by this improper electrical impulse. So sometimes a artificial pacemaker is required to be transplanted into our heart, so that it get normal electrical impulses. So pacemakers are also one of the treatments of heart failure. Okay, now we are going to study a difference between heart attack and heart failure, and this is very confusing to many of the students. Heart attack have happened suddenly, as you have heard, as you have seen in the pictures and in the TV serials, that some people is developing feeling a heavy chest pain, a severe kind of chest pain, and the doctor after diagnosis has told him that you have suffered from a sudden heart attack. So heart attack is a sudden thing. Okay, so it happens suddenly. And why it happens suddenly? Because due to a blockage in the coronary artery disease, and coronary heart disease, or there is a blockage in the coronary artery, which leads to the inadequate supply of oxygen to the heart muscle, and the heart muscle start dying due to inadequate supply of oxygen to them, and which suddenly develop into heart attack. Okay, now the heart failure. Okay, so heart failure which is developed gradually. Okay, heart failure is like I have already discussed, heart failure because the heart's basic function is to pump the blood to all the organs of the body. So if it is not doing its job, then it is heart failure, and it develops gradually. Means there could be various reasons behind heart's improper functioning. So it develops gradually, and most common reason is weakening of the heart muscle, and heart muscles weaken, which cause trouble in pumping of the blood, and suddenly this leads to more of the complications or arrhythmic heartbeat. The heart attack can be a cause of heart failure. Okay, but heart failure is a broad term, and heart failure can be because of various reasons. Okay, and one of the reasons for heart failure is certainly the heart attack. Okay, so now I think this doubt has been clear between heart attack and the heart failure. Heart attack is a sudden stoppage of the heart, and while the heart failure can develop by various reasons, like our pacemaker is not working properly, heart muscles has got weakened up, or there is coronary heart disease, or there is a high blood pressure. So heart failure has many reasons, and generally heart failure, there are some previous symptoms also which are being felt by the patient, while the heart attack came suddenly. Okay, so I hope you have cleared your doubt through this video, and still if you have any doubt regarding this video or any doubt regarding the heart, then you can certainly ask me questions in the comment section. I do follow these comments very seriously and I reply them all. So hope to see you in the next video. Thank you so much.